Hi, everyone. It's Stephanie at MedSpa Distributors. I'm here today with Andrea and Pam. We cannot wait to introduce this new product to you. We're so excited. We're here with the team from Theradome. We have Paul, who's the VP of Sales and Marketing. We also have Penny, who's the Director of Sales. We're also joined by the CEO, Tamim. Cannot wait to hear him explain how this great device works, how we can incorporate it into our aesthetics practices, and how it can help you boost your income. Now I'd love to turn the floor over to Tamim.
It's an honor to be here and explain everything to you and your team. I want to go over the Theradome overview and how we came to the existence and just a little bit of, wide overview of Theradome. So basically, just to get started, let's see, I have to push this button. So we started back in 2014. We were the first LPT laser phototherapy device to receive FDA clearance. So it was a very tough kind of type of task to do because there was no predicates for us to be able to sell against. But it's definitely been quite a road for us to get to where we're at. We think that laser phototherapy is going to be the new modality and also as common as a hairdryer in the next 10 to 15 years. Most technologies takes about 10 years to get into the marketplace. For example, your iPhone, just a few years ago was a flip phone before that, and so on. And now everybody has a smartphone in the industry. Now, we just received our CFDA, Chinese FDA clearance. So now we're in 57 countries worldwide, and we're doing, doing really well all across the world. So hair loss, out of 8 billion people that's out there, about half the world's population has hair loss. So this is a very, very chronic problem all around the world. So people from Australia to China to Asia, and even Ireland, which, by the way, Ireland has the most number of hair loss per capita of any country in the world. They have the reason why is because they have lots of rain and lots of moisture and a lot of fungus, and that causes a lot of hair loss. So I'll talk about that a little bit more. We manufacture all of our devices here in Silicon Valley. This is a made in America product. And the reason why it's made in America is because I'm a naturalized citizen. I came, I was, excuse me, I was born in Asia, educated in France, and became a US citizen. So I'm very proud to make this in America. And really, a product like this that requires to have up to 80 lasers on somebody's head, you want to make these in America because of the quality program, and especially that it's right on the brain. You want to make sure that there's safety issues that are addressed, and that's why we're FDA cleared, because we do what we say, and also we're very safe. There's never been any type of clinical complaints or any kind of adverse effects from our product. So it's absolutely safe. We recruited John Hanassian, who was the former CEO of Bosley for 22 years as our chief strategic officer. He's been with us since day one, and he's been a great asset. So he knows he's definitely a who's who of who's in the industry today. I was just invited to be on the Shark Tank season 16 to be, promoting this product and hopefully getting a lot of awareness on the product. Just a little bit about background on myself. My specialty was in lasers. I started at Kennedy Space Center. That was my first job. And really, my background in electrical engineering, computer engineering, and I did my doctoral work in biomedical engineering. It's my first projects, you can see here on the pictures. I actually invented lasers to measure the thermal protection system of the orbiters or the space shuttles. And so This was a laser that measured these tiles, and it used to take 3 to 4 weeks to measure 25,000 tiles. After my laser that I developed here, it took 1.5 days. So that means that a space shuttle now can turn around and go back into space within 2 or 3 weeks, where it used to be like 6 to 8 weeks. So it saved a lot of time for space shuttle operations. Now, this is my fourth startup. I've done medical devices after NASA, and that's all I've been working on for the past few years now. It's 38 years. If you look at our timeline, we the way I had discovered this product was I read a paper from Dr. Andre Mester back in 1965, when he had accidentally discovered, and most inventions from accidents, by the way, the what Dr. Andre Mester was just had just received a laser in his hospital in Hungary. And what happened was he looked at the laser and he goes, oh, maybe these mice, maybe I can cause cancer on mice. So he shaved up all their hairs on the back of, on the back of these mice, and applied laser light to them. And after a few weeks, he saw that, well, none of them got cancer, but all the ones that had laser light on them all regrew their hair much faster than the ones that didn't get laser light. So he was wondering why that happened. So he asked this new laser technician, what happened? Why didn't they burn or cause any damage? And the technician said, oh my gosh, you know what? I turned the setting too low. And the setting was, instead of 100 watts, it was like less than 5 watts. And so he wrote a paper about that, wow, he published a paper in 1965. And in 1965, he said, you know what, if you apply very low light energy, it actually will regrow your hair. But if you put it at a higher wattage, for example, above 50 watts, what happens? It burns your hair. So that's why, some lasers are used for burning your hair off, and some lasers are, in this case, are for growing and stopping your hair loss. So there's a specific wavelength that is very interesting. It's 680 nanometers, and that's the one we chose with. So knowing that I read those papers back in looking for an application to do, I went with Dr. Mester's paper, which was published in 1965-66, and that's how I built the Theradome. And over the past few years, we've done amazing progress in the awareness that there is another alternative to minoxidil and finasteride. So as you guys know, minoxidil is FDA cleared. It's a vasodilator, and it basically just opens up the blood vessels, since the medication was used for vasodilation for cardiac patients. Now, that doesn't work very well. It was really indicated for men on the crown area. Not very good results, in my opinion. And then finasteride is more of a anti-androgen. Anti-androgens are a little bit more controversial and have a lot of side effects. So, but for women, there was really no way they can use finasteride unless they go post-menopausal applications for women. That's about the only time they can use it. So I went ahead and submitted to the FDA and for both men and women. And so now it's the third option for people to be able to use it. So before there was two, now there's three solutions that are FDA cleared. So we wanted to make sure that we're credible. It's a credible modality for people, and it has zero side effects. So how does LPT stop and regrow hair? It's very simple. Lasers is the only light source that are invented by humans. There's no other light source out there that are like lasers. So lasers, the reason why lasers are so amazing is that it penetrates very deep into the human tissue, and then the scalp is the second most thickest skin in the human body. So as a laser light, when it's coherent, as you can see, it's collimated. So the laser light is not like a LED, for example. LEDs do not penetrate below. There's 7 layers of the skin. The LEDs only go through the first layer, and that's it. So there's 6 more layers left to go for LED. Whereas a laser can penetrate all the way to the two most important areas of the hair follicle. That's the bulge. The bulge is actually where all the stem cells are, and this is where it determines the life cycle of the hair follicle. Now, a hair follicle is supposed to be on your hair for 2 to 6 years. That's average. But when you're losing hair, the hair follicle will only stay on your scalp for about a year or two and then fall off. So that's why if we can stimulate the bulge, then the hair will stay at least 2 to 6 years, sometimes longer. We've seen in papers that it can last up to 8 years in some certain type of races and geographies. So and then the bulb is actually, we stimulate the bulb, which is at the very bottom there. What it does is that it's responsible for the growth of the hair. So if you want longer hair, the what it does is it stimulates the keratin production. So after several weeks, you can see longer and longer hair, and you'll be able to go to um, uh, the barbershop or also the beauty salon a lot more, because the hair grows a lot faster. So there's two things. And then the third thing, what it does, because we're the only device in the world, or or even um, or even a drug that can stop your hair loss. And the reason why our device is the only one, not other ones that have LED or other types of lasers that are sourced for laser pointers that you see for some of competitors. You might see that they all use all of them use the laser pointers that are sourced from Asia, and those actually cause hair shedding. Ours is the only device in the world that stops hair loss. So if you want to stop hair loss, this product is probably the best product to use for just that alone. And of course, it thickens your hair. Then what it does, it starts regrowing your hair. That's how our device works. We have two products, the Pro and the Evo. And the Pro, and a lot of people ask me, like there's 80 lasers, and how did you pick 480 lasers, and then the Evo has 40 lasers? Well, 80 it's kind of like the best analogy is the Goldilocks and the three bears. You have, Papa Bear and Mama Bear and Baby Bear. Well, the problem is when you use more than 80 lasers, it's just way too hot, because the temperature of your scalp is over 98.6 degrees. So you have too many lasers, and then if you have too little, let's say less than 20 lasers, you just have not enough energy. So we have two products, the 80 and the 40, which sells really well, and we primarily target the 80 or the Pro for professionals like yourselves. And then the Evo is really targeted for direct to consumer models. They're both exactly the same in terms of efficacy. The Pro you use twice a week, and the Evo you use 4 times a week. So if you use both of them as recommended, you get the exact same results. You just have to use the Evo double the time that you normally would of the Pro. So we have all this is made in America. We have protective bag, foams, 80, and then we use the 5 volt, just like you would any kind of type of Android or your iPhone. Now, a lot of people have said, how do you power 80 lasers with only 5 volt? That's one of the most challenging things that we had to do as the design of this product helmet. But what we have that no other device in the world has is that we run at 680 nanometers. So the higher, or I can say the longer the wavelength, so if you get up to 700, um, you get much deeper penetration. We get 2.5 times more penetration into the scalp with 680 versus using the laser pointers that are at 650, 635 nanometers. So we're about 2.5 times more powerful in terms of tissue absorption. The other thing that the product has is that it guides you. It's a button push. So it's really easy to use. You just push the button and there's a voice that guides you along. It tells you how many minutes you have. You can control the volume. You can actually keep track of number of treatments. It'll tell you that, hey, you have 43 treatments so far. And it tells you a lot of information. It has 3 battery sensors, heat sensors. It has all kinds of intelligence in it, but it only has one because we wanted to make sure that it's easy. And it's, a lot of people love the iPhone and they love that design element, that it's really, really simple. So all these lasers and the devices made in America, which is really, really important to know, that all these devices are checked by 3 quality teams before they go out. So we've have hundreds of thousands, and we have all total, we have about 80 million treatments on these Theradomes today. 80 million treatments worldwide on these Theradomes. And there's never been a defect of our helmet. We have 0 defect on our helmet. The only thing that might go wrong or anything like that is the battery, which you have to change every few years. It's a battery-based device, so you have to change the battery. I think it's we just just uh, we just designed a new battery that lasts up to 5 years. So before it was 3 years, but now it lasts up to 5 years. And then cable, you know how cables are. It's cables. If you yank on the cable, it might break or whatever. But the helmet almost never goes wrong. But the battery and the cable are the ones you have to be careful of. Just like any cell phone device. I know I have 3 daughters and 3 kids, and I feel like I'm buying cables every other month for them. So that's the only thing I would always suggest. But overall, it's a comfortable device that you can wear 20 minutes twice a week. And we've been on Better Business Bureau for about 10 years. We have an A+ rating. So we make sure that our customers are taken care of, which are your customers are our customers. And so we're the most award-winning product in the world for this category. And let's see what else I can say about that. But that's really the Pro. And the Evo, as I mentioned, is exactly the same in terms of energy delivered in a 1 week time frame. So the FDA looks at energy delivered over a week time frame. I know it's kind of different, but they look at how much energy is delivered to the scalp within a week, not in a session, not in a day, but over a week. So if you look at 4 times a week with the Evo versus 2 times a week on the Pro, they're both equivalent. And the difference is just cost, right? So some people just want to do twice a week, and some people do 4 times a week. But at the end of the day, it's really up to preference and budgetary preferences here. Same kind of type deal. We introduced the Evo about 5 years ago, and it's doing really, really well. These are some of the awards that we've won. We've won Aesthetic Winner, Product of the Year. We've won the Hollywood Beauty Award. A bunch of little other awards for beauty awards. But overall, we have lots of, I would say, celebrities and famous people using it. I can't say exactly which ones, but we have a lot of people, famous people, use our products. We sell in many places. We sell at Harvard. We sell at Cleveland Clinic, University of Miami, University of Utah. There's a lot of places where we sell our product. We've been featured on New York Times, Refined 29, and also Rolling Stones, and what was the other one? Extra. They did a feature on us. So we're getting a lot of recognition. We're going to continue to get more recognition as we go along because it is a new modality that people are very interested in. So really, my next slide here talks about why Theradome. Why, if you're going to put this in your clinic or a spa or salon, is that the fact is, this is a very interesting fact, is that 65% of all people or patients entering any kind of medical clinic or salon over the age of 30 are experiencing some type of hair loss and looking for a simple, effective solution. But the problem is they don't know who to ask for these kind of type of solutions. So what we're trying to do is we're trying to educate salon owners, cosmetology owners, aesthetic owners, physicians, spas, all of these experts to do very little, just to inform them that there is a solution for hair loss. Because what this does, even if you can sell about 2 units a day, which is really simple to do, if you have, depending on your traffic of your building, but definitely you can make up to $20,000 a month selling Theradomes for your patients or your customers. What's interesting about the Pro is that 98% of the people will qualify to use for Theradome. The only people that will not be good candidates for the Theradome are the people that have completely slick, bald, shiny scalps. And you've seen them before. You've always kind of asked, how does somebody have a shiny, bald, slick head? And most people think that it's because they're using some kind of Canuba wax or some kind of type of product to make it really shiny. But the fact is that those kind of patients all have a new skin with advanced hair loss, which has only oil and sweat glands. So all the hair is beneath that new skin. So the hair follicles haven't died. They just are way below, very deep into the scalp. And those people are really for hair transplants candidates. And after getting a hair transplant, they should definitely use the Theradome. So because most hair transplants, it only lasts about a year and a half, 2 years at the most. Then they have to get again. But with the Theradome, if you take the Theradome right after a hair transplant, 90% of the hair stays within 5 years. So that hair transplant that's why our customers like Bosley and Hair Club recommend the Theradome, because it extends the time for hair transplant to stick on the scalp. Otherwise, they have to come in again and again to redo the hair transplant. So it's a good device for everybody to use over time. Now, what we've done is we have a very comprehensive training module, because lasers, when people talk about lasers, they get really nervous, right? It's lasers is even physicians get nervous about lasers, because lasers are a very complicated type of technology that's man-made, and so we try to have an e-course. We have an e-course that we've had thousands of people taking this e-course, and it's about an hour and a half long. And we have LPT 101, LPT 100. We have also other e-courses. We have about 4 e-courses altogether that somebody can take and learn all about it, and they get a plaque, and they can hang it proudly on the wall, knowing that they've taken courses on laser phototherapy, and they can talk from a position of strength when they are talking about laser phototherapy, especially Theradome. So we also can schedule webinars, excuse me, and live Q&As like this, and be able to answer any questions. We also have many white papers and videos for any kind of type of clinics and how to really bring up hair loss with your patients. That's one of the things, is that it's not really selling them the Theradome. It's really, how do you approach somebody that has hair loss and say, hey, we have something for your hair loss, without being too intrusive. And try to make it as smooth as possible transition without trying to sell them. Also, um, I make an offering for my new book that just came out 3 weeks ago. It's the #1 best-selling book on laser phototherapy hair loss. It was #1 on Barnes and Noble worldwide, and also on Amazon. And it's the first and only book on laser phototherapy. And this is available 446 pages of pure knowledge about laser phototherapy, and it's a 5th grade level reading, which is really interesting. So when you compare the Theradome against any device in the world, regardless the number of lasers, if somebody tells you, hey, there's 300 lasers, I have 200 lasers, I have 100 lasers, nobody can beat the Theradome 80 lasers. The reason why is that we have um, the strongest lasers in the world. But if you look at the laser right here, we have cooling. All the cooling, all the lasers are cooled with 24 karat gold. If you look from the top of the helmet, you can actually see 24 karat gold heat sinks on top of it. None of these devices have this kind of technology. So we're about 88 times stronger than these bands or these other LED combinations, and we're 5 times stronger than. But the problem is that all these devices all cause shedding. So you can wear these devices, unfortunately you will have shedding, whereas our device is 727 joules per square centimeter, which is a lot of dosage with no side effects. We also, excuse me, just deployed a major a rollout of a infomercial. It's a 30-minute infomercial which airs in almost every day, up to six airings per on the weekends per day. Now on the weekends, and so we are also using social media to make people aware, and just trying to get the awareness about laser phototherapy and Theradome in general, because we want people to know that, unlike finasteride and minoxidil, where they're backed by big pharma companies and they have unlimited dollars. We're trying our best to make it aware, and having people like at the salons and spas and clinics being able to back up this technology will be very good for everybody involved. As I mentioned, the Grow Back book, it's the first book in the world that this is available in ebook, and we have an audio that's coming out as well. But the main objective is to educate people on the authority of LPT and hair loss. Now, we're going to officially launch the book on January 24th. And it just won an award last week from Detroit Free Press as one of the best books that came out there. And when I wrote this book, it took me longer than to write the book than to design the Theradome, because it was so difficult to make this a very complex subject into a 5th grade level reading. So the best comments I've gotten is that this is one of the, it's a page turner. Some people have told me that it's easy to read, and you can learn all about hair and what's out there, and shampoos and conditioners and supplements, and all about hair transplant, about microneedling, about all the modalities that are out there. And I explain scientifically how all of them relate to one another. As I said, I've been invited to the Shark Tank 2016. We'll be out there, and hopefully we'll be selling a lot of units. We also made a helmet specially for Cristiano Ronaldo. Cristiano Ronaldo, as you know, is the #1 most Instagram follower in the world, with about 500 million people following him. He loves our product, and I met his whole family, actually, his mom and his wife, and we've definitely have a great partner internationally for this product. And so photobiomodulation is important because Cristiano Ronaldo loves the hair. And if you know, he always has a new haircut between games and other things. We are also launching our topical and supplement. And the reason why we're doing that is because the problem is there's millions of shampoos out there, but unfortunately, most of the shampoos out there destroy people's hair. That's the problem. Our Theradome has to work much, much harder when people use really bad shampoos. And the bad shampoos are the ones that has phthalates and silicones and sulfates and really artificial fragrances and parabens. So we took out all those type of caustic ingredients, and then we added, and the #1 reason for hair loss is because of a fungus called Malassezia furber, and that's why Head and Shoulders have been the #1 shampoo in the world since 1955, because over half the population has dandruff, and dandruff causes hair loss. So what we did is we added a new ingredient, which has never been used before. It's called pyroxynolamine. And pyroxynolamine is got hair growth potential, as well as eradicating dandruff. And you can never kill dandruff, but you can control it for at least 3 to 4 days until it goes back on your. So we have a medicated shampoo, we'll have a medicated conditioner, and we have one of the strongest supplements out there with quercetin. Quercetin is actually one of the best hair growth supplements, as well as curcumin. If you notice, we don't have any biotin. We don't believe in biotin. We believe biotin is probably the most overrated ingredient in the world for hair. So we don't include that. We include quercetin, curcumin, B12, MSM, and iron for women, as well as folates, and zinc for men. So we have everything in there to be a fully comprehensive system for laser phototherapy for the scalp, as well as the shampoo, conditioner, and supplements. Now, all these products are better than Nutrafol and Viviscal, which are the leaders in the supplement. Unfortunately, they're very, very expensive, and there's nothing really out there that competes with them, and we'll be able to compete with that as well. And then if you look at where we're at as a technology, so there was a famous book written that technology, actually, the way it works is that a lot of people that are very desperate for hair loss, they go to specialized hair loss centers, and then there's aesthetic centers, like, okay, I have some hair loss, but they don't have a solution. And then when they get into the mainstream, that's when it gets into retailers like Costco and others. And so crossing this chasm of being able to get into the mainstream market has been the challenge for a company like ours. So this is where we need help on being able to make this great technology aware of what its benefit is: zero defect, zero side effects, and also we have the stopping of the hair loss. Now, to conclude, why the Theradome is the best product out there, the best thing I can say is that the Theradome is the ultimate anti-aging hack. If you wear this device, you will reverse hair loss, you'll stop your hair loss, you'll gain more hair, and you'll look younger. That's just the fact. When people have more hair, they look younger. That's in my opinion, that's the ultimate anti-aging hack. Now, if you want to, get some takeaways from here that we've covered, 65% of all patients that enter the clinics are very concerned about hair. So this is a great product that you can address almost all the majority of your patients. And then this covers both men and women androgenic alopecia. Androgenic alopecia is for 93% of all hair loss. So other hair losses like alopecia areata and all that, those are very, very minority of all the hair loss. But androgenic alopecia represents 93% of the types of hair loss. And our device is the only device in the world that stops hair loss in less than 30 days. So if you have a problem with people with hair loss, this is the product. And it's made in USA, as we said. This is very important because this device, if you're going to wear something on your head like this, you want to make sure that there's no side effects and that there's no possible issues with down the line of any kind of type of energies that you don't want to enter the brain, especially at this point. Otherwise, we have really lots of studies that are randomized, multi-center, double-blinded. We're the only device out there that has a randomized, multi-center, double-blinded, sham-controlled IRB trial, and it's out there on the clinicaltrials.gov. That study is available for anyone that wants to review it. But otherwise, thank you very much. And if you have any questions, please let me know.
Thank you so much for joining us today, Tamim. What an incredible amount of information on a very important topic. We're excited to be bringing Theradome to our estheticians and beauty professionals. If you're ready to expand your offerings to your clients, we've prepped an exclusive introductory offer just for you guys. I can't wait to continue this conversation with you, so please reach out. Thank you.